Hi, I'm Tracy and I'm a chiropractor at Graeme Spinal Health, and I want to talk to you about one of my favorite tools at the clinic, and it's the Dr. Graeme General Purpose Massager. A lot of our patients have bought one to use at home, so I'd like to give you a little information to help you better understand why we use them in the clinic and how to use yours at home. The first thing you might notice is that the Dr. Graeme is a vibration massager, and one of the main issues treated by our massagers are trigger points. Now, trigger points are the lumps you feel in tight muscles that shoot pain when you press on them. Whereas massage by hand requires deep pressure to get to a deep spot, which could be very painful, the Dr. Graeme uses vibration to penetrate the muscles. Our research shows that vibration causes muscles to relax and it stimulates blood flow. That research is available in the manual that comes with every Dr. Graeme. There are 3 attachments that come with the massager. The first one is the flat head soft cover attachment. This one is good for large areas. The next one is the one I like to call the knuckle attachment. It's good for smaller, hard to get to areas, but also for a more focused spot. I like to use it on the traps and around the shoulder blade, but you can use it in any area that feels comfortable. The third one is the multi-finger attachment, and it's made to deliver vibrations at a higher speed without the head bouncing. I use this one the most on my patients when I want to relax their muscles before a treatment. Also, because vibration stimulates blood flow, it helps improve circulation and therefore helps reduce inflammation. So there's an on and off switch on the bottom, and there's a variable speed slider on the top. Faster for superficial muscles, slower for deeper muscles. When you're using the Dr. Graeme, you don't have to push down. It is a nice heavy tool, and the resting weight is sufficient to relax the muscles. You can press down a bit if you're comfortable with that. When you're using it, it's a good idea to start with 30 seconds at a moderate speed for a typical trigger point, 60 seconds for a deep trigger point, and there may be multiple trigger points in an area. You need to allow it to cool down after 15 minutes of use. So there's a couple of do's and don'ts that this might not be appropriate if you are on blood thinners, you bruise easily. You definitely want to avoid going over bony areas like the hip bones or the shoulder blades. You'll also want to avoid using it on the neck, so it's not comfortable. There's too many superficial bones there, so it's best to avoid that altogether. But do enjoy the Dr. Graeme on all of your sore muscles. Feel free to ask any of us at Graeme Spinal Health with any questions that you might have, and we'll see you soon.